Bakar is a pediatrician at Al-Ahli Hospital in Doha. He joins me here in the studio. It's great to speak with you again. Thanks for your time.
Nice to meet you, Tony.
We don't use that term anymore, do we? The whole
Which
idea of test tube babies.
No, test tube babies is not anymore used, but you use more in vitro fertilization.
Yeah, it really is.
Right. And actually, the fertility treatment has passed by many stages, assisted reproduction in different ways. The most recent and most developed is the in vitro fertilization, where you get the fertility to happen outside the human body and then return the embryo to develop inside the human body again.
You know, this whole procedure was hugely controversial in the early days, wasn't it? There was a lot of opposition from the clergy, from ethicists, and how did we work through those issues?
Up to date, there are lots of cultural, religious issues regarding in vitro fertilization, especially that the subject has been more and more complicated with if you talk about sperm donation, egg donation, using a uterus which is not the mother, the real mothers, you can hire another uterus. So there are lots and lots of issues complicating the IVF nowadays, and it will continue.
Well, another one of the reasons why the world was able to work past some of these controversies, I know it's still an issue for the Catholic Church, is in vitro kids, they're healthy kids, aren't they? I mean,
in vitro kids, they are healthy kids. They can be completely
normal. In some cases, they've had their own children.
Right. Yeah. I mean, but in vitro kids, they are more liable to some problem because of the procedure, like birth. It's proved now that birth defects can happen more in vitro kids. The risk of having premature babies because of multiple pregnancy and so on. But if it becomes the only chance for a couple to have a child, then yes, we should go for it.
Well, let me ask one more here. So, and you can help me sort of establish the pecking order here. Obviously, Dr. Edwards and Dr. Steptoe received the Nobel Prize for the research, a lot of the research in this area. Where does Professor Wood fit in that pecking order? What does he get credit for?
Yeah, all these people, they started working on the idea of assisted reproduction, in vitro fertilization early enough. It's true that the first IVF baby, her name was Louise Brown, was born in Manchester in UK in 1978. And that was before the, between brackets, the test tube baby of Dr. Carol Wood, who was born in 1980. But Dr. Wood had the first Australian IVF baby, and also we have to give him credit for improving and developing the methods of the IVF, so the quality of the IVF to a great extent. Because, I mean, the chances of success were really low, but now the chances of success approach 41% in mothers who are less than 35 years or around 35 years, which is a very good rate of success.
Well, I was about to ask about the legacy, but I think you've just outlined a pretty powerful legacy there, Dr. Bakari. Great to see you again.
Good, thank you very much.
Yeah, thank you.
Okay.
Thanks for your time.
Bye.
All the sports action still to come here on Al Jazeera, including